Introducing Amnio-Disc, a breakthrough in outpatient care for ocular surface disorders, especially for patients experiencing extreme discomfort and compromised vision. Developed by Akriti Ophthalmic in supervision of Dr. Kuldeep Raizada and Dr. Deepa Rani. Amnio-Disc offers a suture-less, minimally invasive solution to restore ocular surface integrity and visual comfort. It's designed for a wide range of indications: post-refractive surgery, dry eyes, superficial punctate keratopathy, epithelial defects, corneal ulcers, and post-pterygium surgery recovery. Application is as simple as placing a bandage contact lens, yet it delivers powerful therapeutic benefits. Amnio-Disc is processed from human placenta under stringent tissue handling protocols at Akriti's GMP-certified facility. Each disc is gamma-sterilized and available in sizes ranging from 6 mm to 14 mm, ensuring compatibility across diverse patient needs. The product is CDSCO approved, GMP compliant, and registered in multiple countries, reflecting its global clinical acceptance. In practice, Amnio-Disc is carefully removed from its sterile pouch and gently held using McPherson forceps. The disc is then placed over the corneal surface, ensuring minimal handling and tissue trauma. Edge adaptation may be required, which can be performed using PVA spears to contour the membrane gently. Under a slit lamp or surgical microscope, confirm precise centration over the cornea. Once properly positioned, a bandage contact lens is applied to secure the disc in place, allowing uninterrupted healing and optimal therapeutic effect. Over the next 5 to 7 days, Amnio-Disc is naturally absorbed by the eye, supporting epithelial regeneration and reducing inflammation. Standard post-application eye drops should be administered as per clinical recommendations. Amnio-Disc, healing made effortless. Explore more at akritiophthalmic.com.